Thank you, Concordia. I want to begin again by paying tribute to all our workers who are doing such amazing work for us all at this time, particularly those on the front line, and to offer my condolences and that of my party in relation to all the families who have lost loved ones over the last week. Taoiseach, I want to raise 4 issues with you today. I'm back on my transparency issue. I want to significantly concentrate on secondary non-COVID morbidity, because it's a real issue. The disability sector, which I think is a sector that's actually been forgotten about, and also childcare. But before I begin, I just want to say that the handling of the Leaving Cert has been an unmitigated disaster. So please intervene. The stress that these students have been put under has been intolerable. And this needs to be finished. We need a plan B, and it needs to be out there this week, and it needs to be agreed. This cannot go beyond this week. It is unfair. It's completely wrong. And the handling of it from the Department of Education has shown a dysfunctionality that hasn't been seen in some while. Taoiseach, 2 weeks since I wrote you asking a number of questions regarding decision-making on NPHET. You didn't really answer my questions, so I wrote you again last week, and you haven't replied. Now we notice that NPHET hasn't published any minutes again for the last six meetings. This was meant to stop. It hasn't. Interestingly, in your letter to me on April the 29th, you said that the famous 100,000 testing target was set at the NPHET meeting of April the 14th. However, the minutes of that meeting have no mention of it. So how could they be set at that meeting? You correspond to me and say that's where it happened, but the minutes don't reflect that. So what's going on? This is deeply concerning. I've also asked you to publish the letters written by the Chief Executive and Chairman of the HSE to the Minister of Health and the Department of Health, and they still have not been published. So I'm asking quite publicly for the 3rd week in a row, why not? What are the government afraid of in these letters? I'm getting worried, Taoiseach, about the reputation of this government for transparency when it comes to answering questions, when it comes to freedom of information, when it comes to the use of GDPR, and the volumes of times that answers are not being given or people are being fobbed off, whether in political or journalistic circles. It's happening too often. The publication of the roadmap last Friday was very welcome. However, the government was very quick to rule out that there were any divergence in views between the government and NPHET. The CMO, Minister Harris, on Friday evening at the press conference said that the government completely followed the plan. The Taoiseach has recently said the same thing. Yet Philip Ryan in the Irish Independent twice this week has shown that this factually simply is not the case. This is an undeniable fact now. So I've been trying to get a real insight into the government's relationship with NPHET, hence all the questions that haven't been answered. I want to know exactly why did the government choose to deviate from the CMO's advice on the wearing of face masks and on cocooning. Others may not have noticed, but there were also changes in relation to social visits, in relation to retail services, and specifically in relation to travel measures across the grid. I really am concerned as to why the government are afraid to explain all of these. Why are they afraid to admit that they disagreed with the CMO and NPHET and didn't implement 100% their plan? NPHET advises governments make decisions. I don't understand why you can't just admit that and we'll all move on. For me, it isn't actually a big deal. For me, it's actually possibly a good thing, because I believe you're going to have to deviate, take into consideration secondary morbidity, other social economic issues into the future. But I'm concerned, indeed it's very worrying, why you're not willing to be open about this. Very open about it. And it consistently has been denied. In relation to that issue of face masks, very pointedly, Taoiseach, we need a plan. The government needs to give guidance on this. Its messaging on it has been all over the place. And secondary morbidity, we're facing into a catastrophic situation, Taoiseach, unless decisions are made and made quickly. As COVID-19, thankfully, hopefully, becomes more controlled, and well done to everybody for all their work, and because of the way society has now been socialised around COVID-19, we know that there are people dying from deaths that are preventable in normal circumstances. 30% of clinical healthcare appointments are not being fulfilled, 30% drop in inpatient activity, 50% decrease in GPs referral to rapid access clinics. In the UK, they've made an assessment that 18,000 more people are going to die from cancer. We've no screening programmes, scale back diagnostics, trim down community work, and a drop-off in mental health and disability services. I know of one woman who has been told she's going to have to wait 24 weeks for a colposcopy test results. We've been here before, Taoiseach. We can't go back there. That is not acceptable. So we need a public awareness campaign to ensure people re-engage with the health service, and patients need to be assured that if they go to a GP or need a hospital appointment, that they can do so, and it will be safe. This campaign needs to be backed up by a plan to get our health service moving. I believe that the roadmap that you published actually has a huge gap in it. It needs a correlation of a plan in relation to how we're going to get our health service moving as well in tandem. So I have a critical question for you, Taoiseach. Who will draw up this plan? Is it NPHET or the HSE? It cannot be NPHET. It has to be the HSE. Please assure us that that is what? A plan for reorientating, redeveloping, restarting the health service. It has to be the HSE. It cannot, in my opinion, be NPHET. They have a certain mandate and a certain competency, but it's the HSE's role to deliver health services in this country. Otherwise, the board of the HSE and governance of the HSE may as well not be there. I think an issue missing here from the puzzle is obviously the whole issue of normality. And I do fear that in order to get people back to going to their appointments and re-engaging, that you're going to have to re-look at the roadmap as regards these 3-week intervals. Because I predict that you and your government will reach a pendulum point, Taoiseach, in the next few weeks, where non-COVID preventable deaths could possibly outweigh COVID deaths. And this is something you're going to have to consider carefully. How healthcare is performed has changed, how we're going to configure attendances at clinics, where people are going to wait, the use of PPE, all of this needs to be prepared for and changed. And we also know there's a real danger coming down the road with the winter flu. So Taoiseach, please take on our request in the Labour Party and just give the flu vaccine free to everybody for the next year. We cannot countenance the idea of dealing with COVID and the flu at the one time. So please, please do that. I think everybody in the House believes that's a good idea. When it comes to, there's been an awful lot of good innovations that we need to keep, Taoiseach, collaboration with GPs, e-health, video and phone consultations. But we also need to ensure that we do what Paul Reid said at the beginning. We have sláinte care on speed. The nationalisation of some of our private hospitals for the 3-month period hasn't been optimal, and that needs to change. But it is a good thing, and it is something that needs to continue. We need bed capacity. Sláinte care identifies it. This is the quickest way of doing it. And I had to say, I cringed when I saw in prime time a certain consultant who said that he didn't care, really. He was agnostic as to how people, what door they came through, public or private, as regards treatment in his clinic. But that same consultant has not signed up to work under the current COVID arrangements. I dare say that consultant would care if a patient couldn't pay. That needs to change. In relation to disability services, Taoiseach, I do believe that we have taken our eye off the ball collectively here. Many people with intellectual disabilities, I'm hearing, are suffering greatly. And the lack of assurance as to when day service and specialised services are coming back into place needs to be addressed, and needs to be addressed immediately. Many of them have underlying illnesses. Finally, Taoiseach, in relation to childcare provision, I don't believe the government have got their heads around this. I saw 8 weeks ago the plan that the Minister for Health had in relation to this. He showed it to me, in fairness, that he had it. The fact that it's taken this length of time isn't acceptable. I also believe the idea that we don't have the detail on it worked out by now isn't acceptable either. But also, Taoiseach, I don't believe the plan as regards childcare opening and the intervals as acceptable. I don't believe it's going to work, because we need to mobilise and get people into a normal system again. And the way in which childcare has been phased in is going to have to be brought forward. Also, the whole issue of maternity leave. Women who have had children and are on maternity leave, you need to consider extending that, because they haven't been able it hasn't been a normal situation where children have been able to be with their parents over a considerable period of time. So I'm asking you to consider extending maternity leave in some way, so that these parents can look at how childcare provision can be brought about and can actually be able to embrace that period with their children. I do believe there will be an issue with some childcare providers as regards taking on young babies in the current circumstances, and the government needs to consider this and plan for this as well. Thank you.
Thank you very much. Deputy Róisín Shortall.
Yeah.
Happy to answer some of the Deputy's questions had he allowed me time to do so.
Yeah, and it is. Sorry. Well, wait now, Deputy Kelly.
He asked me questions that he knows I can't answer, so he can then accuse me of not answering them.
No,
No.
answer my letter. So
Please.
You ask me questions about what happens at meetings I don't attend. In fairness, Deputy, you know I can't answer.
You're the teacher of the country.
The provision is made in the order for. Sorry, deputies. In the order for today, the provision was made for questions and answers. If members decide to consume all the time asking the questions, then they can't expect to get answers. So